Did you know that cervical cancer is preventable? Yes. My name is Kauthar, and today I'm going to be talking to you about cervical cancer. Cervical cancer is the cancer of the cervix, which is, the neck of the uterus. It is the fourth most common cancer in women. But the good news is, it is very preventable. Cervical cancer is caused by the Human Papilloma Virus, HPV. It's a very common virus that is transmitted through sexual contacts. Now, HPV is of various types, like several types, about 100 or over 100. However, most cases of cervical cancer has been linked to HPV 16 and 18. Now, symptoms of cervical cancer at early stage, it shows no sign. However, during the advanced stage, it may cause regular and abnormal vaginal bleeding. It would cause pelvic pain and vaginal discharge. And like I said, the cervical cancer is very preventable, and the key to it is early detection. And how this can be done is through HPV testing and pap smear, just screening for signs of cancer in the cervix. HPV, like I said, is a very common sexually transmitted disease. Most sexually active people or persons have HPV. However, it can actually, just resolve itself, or it can lead to cervical cancer in women. Like I said, HPV generally is a lifelong virus. It stays in the system. It might not show signs, but it's there, can trigger issues like this, like I said. So HPV testing checks for the virus in your system when you go for the test, and also to see if it is the 16 or the 18 that is present in your system. Now, for pap smear is basically a procedure where your cervix is checked to see if there are signs of cancer. The procedure basically is for them to brush the cervix and take out cells from the cervix and go check if the HPV has caused any concerns or any problems in the cervix. Now, that's the difference. HPV testing just checks for the presence of HPV in your system, especially HPV 16 and 18, while pap smear screens to see if anything is abnormal about the cells around the cervix. Now, besides that, there's also HPV vaccine out there, but the vaccine is usually recommended for non-sexually active persons, especially kids that are between the age of 11 and 12. I don't know if this practice is, I doubt if it's very common in Nigeria, honestly, as sad as it might sound. And it's basically not just for girls, it's for boys as well. So what it does is just to stop them, prevent them from getting infected with HPV. All right, that's what the vaccine does. And girls between the age of 13 and 20 also meant to take it. So on this note, you might have to check with your doctors to see if it's a service that is offered in your hospitals or your clinics that you use. Like I said, basically the key to preventing cervical cancer is going for testing. And this testing can actually be done alone, as an HPV testing can be done alone or in combination with pap smear. But it's advisable that you do both at the same time. If you do both at the same time, you can do it once in 5 years. But if it's done on its own, like just doing HPV testing or either pap smear, it can be done once in 3 years. So, it's preventable, thankfully, and it's treatable. Even if they check and see abnormalities, there are steps that can be taken, to prevent it from blowing up to a deadly, deadly stage of cancer. So, like I keep saying, take care of your health. Most importantly, go out there, take this test, go for pap smear. It's not a very difficult procedure. Maybe it might just be slightly uncomfortable stuff, but I mean, compare the uncomfortability of the test and the risk of getting cervical cancer. And I must point out that there are certain factors that actually increase the chances of getting HPV, and that would include having multiple sex partners, many births, a compromised immune system or a weak immune system. That's people who probably have HIV, and birth control. Prolonged use of birth control methods can actually increase your chances of getting HPV. So like I said, it's nothing to worry about. Just go get yourself tested. And that you test positive for HPV does not necessarily mean that you have cervical cancer or that you're going to have it. It's just to know how, if there are any damages HPV, the virus is done in the cells of your cervix. That's basically what it is. So just keep staying safe. Go out there, ask your doctors questions. Ask them to advise you on how to go about it, and keep staying safe. I'll see you in the next video.